Welcome, everyone. My name is Scott Barrett, and I am a professor and vice dean at SEPA and co-host with Jeffrey Sachs of this webinar series, COVID-19 Policymaking in the Throes of a Global Crisis. And I'm delighted today to welcome a distinguished panel of three people to discuss the intersection of COVID-19 and international trade. The structure of this seminar will be a little different from the other ones. Dean Merritt Janow will chair the discussion with our other two guests, Chad Bown and Mari Pangestu, and she will introduce them. And then after they interact for some period of time, she'll come back to us, and then I will ask questions along with Janow Ben-Amour. Janow, great to see you. And Jeffrey Sachs, who hasn't joined us yet, but we expect that he will. As always, I'm grateful to Andrew Wilson for commanding the entire operation. Dean Merritt Janow, my close colleague, we were Zooming just not long ago, maybe 2 hours ago. Everyone knows her at SEPA as Dean. I'm not sure everyone knows of her background and her engagement, particularly on matters involving international trade. She was a member of the World Trade Organization's appellate body, which is the final body to hear disputes within the World Trade Organization. Quite a remarkable institution. And one that when it functions, I think people don't appreciate just how much it has been able to achieve. And before that, she's held on other positions in the US government, including as US Trade Representative for Japan and China. So what I'll do is I'll turn over to Merritt. Merritt will introduce Chad and Mari. And after their discussion, we'll open up to our group for questions and then the audience for questions. Jeff, I see you've joined us. Jeffrey
I just was able to get off the last call. So Mari, how are you?
Hi, Jeff.
Great to see you.
Great to see you.
Hey, Merritt, how are you?
Very good. And thank you for inviting us to join you. I'm really delighted to be part of this discussion on COVID-19 and international trade. And I'm particularly delighted to be undertaking this with really two of the world's leading experts in international trade, as well as our own remarkable faculty leaders, Jeff Sachs, Scott Barrett, and very pleased to meet you, Janow Ben-Amour. So Dr. Mari Pangestu is at the World Bank now, and in fact, just joined in March. Quite a year to join, and she is a managing director of development policy and partnerships. In a word, she is really the second person there in charge of all of research and data for the World Bank Group, as well as external and corporate relations. And she comes to this role with an extraordinary background, having served as Indonesia's Minister of Trade, as Minister of Tourism and Creative Industries, over 30 years in academia, involved in international organizations, and was a visiting professor at SEPA as our George Ball visiting professor, and then a senior fellow, continuing to teach an adjunct course at SEPA. She's also taught at the Lee Kuan Yew School and the Crawford School of Public Policy in Australia. She's on the board of many international NGOs and organizations, has a PhD in economics from Australia National University. So Mari, I feel it's a homecoming, and I really want to thank you for making time to be with us and at such a relentlessly busy period for the World Bank Group. And Dr. Chad Bown is an extraordinary economist who I've had the pleasure of knowing for some years. He is the Reginald Jones Senior Fellow at the Peterson Institute for International Economics. He is also the co-founder of a fantastic weekly podcast on the economics of international trade called Trade Talks, which I encourage everyone to pay attention to. He was a senior economist at the Council of Economic Advisors, lead economist at the World Bank, earlier a professor of economics at Brandeis, the author of many important works, including recently a number of really powerful essays in Foreign Affairs and through Peterson that I've directed to those in this seminar to read in advance of today's discussion. And I thought what we might do is, international trade in COVID-19 is a very sprawling topic, and many important dimensions, I think, are important for us to consider. And I thought we might try to touch on, in the next 20, 30 minutes, three. I mean, first on sort of what have been the global economic effects of the pandemic on the global trading system and supply chains. Second, more on global trade and medical equipment, vaccines. What do the rules have to say? Where might we go to try to imagine the trading system being in support of resolution of this crisis? And third, what can be done and what should be done, what is being done and what could be done to assist the poorest and most vulnerable countries. So to start us off on thinking about really the pandemic and trade, it kind of gets you into a conversation about globalization itself. And, we're in a period of a shock brought on by the pandemic, a deep recession. Global trade has obviously dropped significantly, and some of that, I think, is usually the case when economies slow. But it's also a period of growing nationalism, of geopolitical tensions between major powers, and sometimes in the period of shocks or in their aftermath, the world can move to greater openness. And sometimes we've seen just the opposite, where there's been an inward look and resistance to globalization, concerns about the vulnerabilities of interconnection. So I guess I'd like to invite you both to start off by giving your sense of what's been the consequence of the pandemic and its economic consequences for the international trade and the international trading system. Chad, would you like to start us off?
Sure. So thanks to everyone for the opportunity to be with you. It's a great pleasure and honor. I would say the full implications of the COVID shock for trade and the trading system have really yet to play themselves out. And I think there is a concern, certainly early in the crisis and probably even thus far, to blame a lot of the disruptions that have taken place because of the COVID shock on globalization and on supply chains in particular, right? And so there's been a lot of talk about the need to reshore certain things. We'll talk more about medical supplies and pharmaceuticals and that. Almost as if every problem that will have happened is somehow because of supply chains are global. And I think we have to recognize that in many instances, the fact that supply chains were global was actually a feature and not a bug. So as we've seen the pandemic play itself out in different geographies around the world, different countries in different spots have had to go under lockdown at different times. And so that has meant, the lockdown of economic activity, and that has, meant a heightened role or need for international trade when you had local shortages, whether we're talking about potentially food or medical supplies. Certainly there have been supply chain disruptions, but I would argue here in the United States, we have seen, probably equally many domestic supply chain disruptions or mismatches between supply and demand. We're talking about the kind of classic toilet paper story where we have shortages of toilet paper, not because there's shortages of toilet paper, but there's shortages of a particular variety of toilet paper. We're all now living at home. So the ones that you would buy for your home are no longer available because there's been massive demand, but there's plenty available to be able to supply offices, but nobody goes there anymore. It's not an international trade issue, not a supply chain, just a mismatch of supply and demand. So in any case, there's still a lot of that stuff I think we're gonna have to figure out. Where the supply chain disruptions actually happened that were as a result of international trade and borders and that particular nature, and were supply chains too lean? Was there not enough inventory, built up, enough resiliency, enough duplicity, if you will? And so I think we'll have to wait and see. I think we're still collecting, the data, the evidence. At this stage, it's very much a lot of anecdotes that we're trying to still interpret.
May I invite Mari Pangestu to give your perspective?
Yeah, let me start with the disruptions and the global value chain. I think the narrative has been that trade and GVC disruptions from COVID has worsened the crisis. But in fact, our most recent data that's coming in is showing that trade and GVCs have actually been remarkably resilient. And we have found that there is already signs of recovery starting around June onwards, where the decline of the trade has been slowing down, if you like. And it has mainly been in like intermediate goods, capital goods. And where there are countries and regions most integrated in GVCs, they experience less of a drop, East Asia being one of them. So if you look at the most recent data in September, global trade was actually up 2.3% compared to September 2019. So you're beginning to see the signs, but it's varies by region. East Asia is the one that has recovered faster compared to other regions. And that's partly because they had the COVID first, and then they opened up first. That's part of the reason, but the other reason is because they have these global value chains, regional, which are very regional in nature. So as soon as there's a rise in demand, especially driven by China, then you have somewhat of a recovery. So just to give you a number, January to July, global exports fell by 12%. In China and the rest of East Asia, it fell by minus 5.9%. And in Vietnam, it was actually positive growth. So this is just by comparison. And the other interesting thing, this is interesting for Chad, I guess. We had worried in the US-China tension that China's imports would be diverted to the US and would be at the expense of East Asia. But in fact, you have the opposite trend. What has happened, if you look at China's import growth from the US, it declined. But from the East Asia, it was positive, actually. So from ASEAN 5, it was 7.8%. To the US, it went less negative, but it was still negative 3.2. So I think this is important in the context of later on, maybe when we discuss what comes next. So I think the other thing I would point out, Chad mentioned the word resilience. We also have been doing studies in the World Bank looking at what happens after a previous crisis, like the Fukushima earthquake. How did firms react? And in that case, you were talking about actually offshoring, because they had a lot of supplies in Japan. So they did diversify to increase the resilience, but they would diversify not to many countries, but it would be to one other or two other production locations. So I think in the near future, we are predicting that there will be more diversification, and that was already happening with the US-China trade tensions and the rising cost of China even before that. But, and here's the policy issue. It's still the basic policy issue. Where does the investment go? It will go to the countries which have done the trade policy reforms and are open and have the infrastructures and so on and so forth. So at the moment, the number one country is actually Vietnam, as we know. So, but moving forward, we are hopeful that our CEP, which was signed recently, finally, will actually be more supportive to a greater regional value chain that will develop in the region, because that's the other prediction, that maybe global value chains will become more regional. And then the other policy question is, can we actually have more regional integration in other regions as well?
Mm-hmm. Mari, may I pick up on that last point and ask you, are you concerned at all about some of the incentives that countries are putting into place for reshoring? And it's not just the United States. Obviously, Japan, for example, just put out in its budget incentives for bringing manufacturing back home, as well as in the region. in some ways, this it's talked about a lot, as is discussion around, trying to isolate what are the sectors where it is actually important to bring industry home. The Trump administration emphasized sort of manufacturing writ large, as well as particular parts of related to medical equipment. But are you worried about sort of protectionism in the name of resilience arising around the world?
Yeah, somewhat, but I think it's going to be rather sector specific, perhaps, towards strategic products, right? And because of the crisis, we know that it's food and medical supplies and now vaccines, of course. But I don't, it is worrying. But I think in reality, maybe at the end, unless the government is going to have huge subsidies, because economically or commercially, it may not make sense. You may want to have some, like take vaccine, for instance. It is not going to be easy to quickly deploy manufacturing in vaccines, and it's going to be at a very high cost. So. Would they be able to do that easily is another question. So I think we need to pay attention and keep an eye on it. And hopefully, this is actually very similar to what happened in 2009. If you remember the Buy America campaign for steel, was it? It has to be made in the US, and then the Europeans took the US to the WTO, right? If I'm not mistaken. Yeah.
Yes.
So therefore, I think if you're going to do these kinds of things, please remember that we still have rules, hopefully. And
we do.
That's why the role of the WTO and the dispute settlement is going to be very key, because if you do it, our rules are saying that you can't do it at the detriment of other countries, or your own, well, for your own country. That's an economic argument. At the end of the day, you end up paying more, and perhaps still not being able to have your population fed or vaccinated. And yeah, final thing I would say is that a lot of this originally had, at least on vaccines and pharmaceutical products, had kind of, we don't want to depend on China kind of question. But the reality of it, if I'm not mistaken, I think 50% of the raw materials that go into these things, into the medical production, is coming from China. Even India, which has a strong pharmaceutical industry, a lot of their inputs are coming from China. So I mean, the other side of the question is, yes, you may be manufacturing the last part of it in your country, but let's not kid ourselves that that it is 100% being produced in the country.
Yeah, thank you very, very much. Chad, I'd like to pick up on that point. You wrote a very good piece in Foreign Affairs saying that there needed to be a vaccine trade and investment agreement that would alleviate fears of leaders in vaccine producing countries that are worried about sharing their output, and also respond to the problem. And of course, we have rules in the TRIPS agreement that provide for mandatory compulsory licensing by governments under certain conditions, and we've seen some consequences of the early responses when the U.S. bought up remdesivir and Trump invoked the Defense Production Act and threatened to ban exports. We saw of respirators. We saw, Canada and others threatening to retaliate. So, I mean, and most recently, we've seen a group of countries through an Ottawa agreement try to take this idea forward of turning the international trading system instruments in support of keeping borders open to facilitate vaccine and medical equipment. What is your assessment of how the system is reacting and the availability of these tools to really support a global response?
So, in kind of my research to get to the bottom of this, one of the things that I learned, and this very much picks up on what Marie was just talking about, vaccines are scientifically, as a manufacturing process, just fundamentally different from everything else, including most all other pharmaceutical products, in that there are very, very few countries that are going to have the physical capacity to be able to produce these vaccines, at least in the short term, right? And we want to get these things out to populations as quickly as possible. So what that means is kind of our standard tools on TRIPS for compulsory licensing are going to be of limited utility, right? The poorest countries in sub-Saharan Africa, for example, aren't going to be able to go to the giant, pharmaceutical companies and say, look, if we don't get them access to these through trade somehow, we're gonna be able to produce them locally. It's just going to be an empty threat. And so what that means is ultimately international trade in these pharmaceutical products, in the vaccines, is going to be critical to the health recovery. It's going to have to happen. And so then the question is, okay, well then what are we worried about? Well, we're worried about playing out with vaccines exactly what played out when we had shortages of personal protective equipment and ventilators early on in the crisis. And so this started back in January in China, when there was kind of at least implicit demands of state-owned enterprises and local PPE manufacturers to stop exporting and to provide for the local needs. And at that time, that made sense, right? That's where the demand was. That's where the outbreak was happening. But then we saw this flare up again, first in Europe, where within the European Union, France, Germany were refusing to export this equipment to other European countries and hoarding it all for themselves. And then finally it spilled over initially into the United States, where they were threatening to cut it off, from Canada and Mexico. So the big concern is that the same thing would happen with vaccines, right? They're only going to be able to be produced over the next year or so in a handful of countries, the United States, Europe, China. And so that means, to what extent is the rest of the world going to get access to these? And so what we've seen develop over the course of this year is amazing at some level, but also incomplete. So the amazing bit, of course, is the scientists that have been able to develop these vaccines at amazing pace. And we've also seen the development of this cooperative approach, this COVAX facility, where you have got this one entity, CEPI, that's kind of coordinated a portfolio on the supply side of potential vaccines to put forward to the global community. You've got WHO that has been sort of there to identify, to regulate. These are the vaccines, these are the ones that are going to stand up to scientific scrutiny. They'll kind of oversee that part of the process. And then you have Gavi, the Vaccine Alliance, that's helped to establish how we're going to distribute these things globally through kind of a purchasing agreement to make sure, especially the poorest countries in the world that aren't going to be able to afford them just buying on their own, getting access to them. But the problem is, and so there's this framework set up there that's amazing, that looks like it will work. But the problem is you don't have countries, especially the ones where the vaccines are going to be produced, agreeing not to impose export restrictions, not to agreeing to say, we're going to hoard these things locally. And at the same time, they have been placing advanced orders, sort of taking off the market all of the initial supplies that are going to be put out there. And so what we tried to put out there in this foreign affairs piece was recognition of that and saying, look, in order for the pandemic to get under control everywhere, you have to vaccinate kind of the most critical populations everywhere around the world first. So as much as I want to get a vaccine, like I'm okay working from home. I'm not the one working in a hospital, right? Treating patients every day. Those are the folks everywhere around the world that should be receiving the vaccines first. And unfortunately, we don't have an agreement by, policymakers. Our rules on export restrictions under the WTO aren't really that strong, unfortunately. So this Ottawa group has kind of put steps out there to say we need more disciplines here. We at least need more transparency. If you're going to do export restrictions, let's make them small, targeted, short-lived. But really, I think we need to go beyond that in terms of adding new disciplines to the international system to get countries not to use these kinds of export restrictions.
Thank you. And could I invite Mari, could you make a comment on what you see as the particular challenges of the poorest countries and how organizations like the World Bank or others can help address those concerns? I think you're on mute.
Yeah, Chad didn't mention the World Bank, but the World Bank actually has been involved in all these activities, including, we are part of Gavi on the board and so on and so forth. But we have, our concern, just like what Chad emphasized, is equitable and fair access to the poorest countries, and not like 3 years from now, but early access, because past experiences with vaccines show that the poorest countries will get it last. I think the swine flu, for instance, 3 or 4 years later down the road, did developing countries get it. And it's because you don't have the funding to have this advanced purchasing and so on and so forth. So the World Bank has actually just 2 months ago came up with $12 billion for the financing for the purchase and deployment of COVID-19 vaccines that meet the standards, WHO pre-qual, as well as a stringent authority, one stringent authority. And the idea is to give financing to the poorest countries and to complement COVAX. Actually, what COVAX does is, hopefully they do get the COVAX is still sort of, I guess, work in progress, where there's a lot of questions around it. But the idea is that they would supply 20% of, they've identified 92 of the lower income countries that will be able to get 20% of access to the vaccines. And they have agreements with a portfolio of vaccine producers. But the only thing we know is that there's a 300 million dose from Astra that will be produced by India and already promised to be put into this COVAX pot that will be serving the poorest countries. Another 1.5 billion is still in discussion. And the idea is that the poorest countries will get subsidized by donor funding that is in the COVAX funding pot, either at zero cost or at subsidized price. This depends on how much donor funding they get. And so they up to 15 to 17% will be provided to the poorest countries. So why is this 20% number important? It's the identified number of the vulnerable population. It's the 3% medical workers and so on. And then the elderly population, the ones with underlying conditions and so on. That's kind of the rough number. So there's a whole coordination process trying to at least ensure that the poorest countries get 20%. The rest of it, if they want to have a wider part of their population be vaccinated, then they can get financing from the World Bank. That's the $12 billion. And we also not just provide financing for the purchase of it. We have to think about the other complex part of it is the whole vaccination process itself. We have never done a full population vaccination since smallpox. So it's the infrastructure, it's the health workers, it's the cold storage to store the facilities, it's the logistics, it's the communications to the population. So we're actually right now, I just came from one of the meetings. We are doing what they call vaccine rapid assessment framework in 85 countries to understand just what countries need, where are the gaps, and how can we help countries do that? Because it's kind of a race, because when we started doing this 2 months ago, the news on vaccine was still uncertain, but now there's more certainty actually. So we need to work harder to make sure that once you can actually access the vaccines, you can actually deploy it to the right parts of your population in the most efficient, effective way. So that's what we're doing. But I think there's a lot of, we can talk a little bit about the trade issues if you like. Maybe you said you were going to ask about trade and health issues. I mean, I think there's lots of other issues related to trade. I would just say that on the TRIPS issue, I was trying to ask some of the experts on this, and they said that the TRIPS issue may not be so important for vaccines. It'll be important for the therapeutics and the other diagnostic products. But for vaccines, the important issue is, as Chad mentioned, is the manufacturing capacity to be able to produce enough to serve the world in sufficient numbers in the shortest period of time.
Well, thank you very much. I'd love to keep going, but I'm conscious of the fact that we have some of the world's leading experts also leading this seminar. Jeff has been chairing the Lancet Commission, and doubtless these very questions have been in front of your mind, and Scott has been thinking about infectious disease issues throughout his professional career. So let me invite you to take us forward, lest I abuse the time you've allotted us.
Scott, take it away. And
Oh,
Mary.
I was just going to ask if you wanted to go first this time. Okay, all right, I'll go first. So this was terrific discussion. Thank you so much. On this question of the vaccine distribution, let me just ask two things. One, the US is not part of COVAX. We are for America first. And you know, historically, usually cooperation depends on some leadership, and so the absence of the United States is a real loss for the world. I don't know whether the Biden administration is thinking of engaging with COVAX, but one of my questions would be about how this pandemic has played out because of this really extraordinary incompetence on the part of the United States in handling this crisis. Mari, the point you made about the bank and helping with finance beyond that initial 20%, I'm also wondering why poorer countries would be expected to finance the vaccination and why there wouldn't be more of a grant made available to the poorest states. Maybe I misunderstood you. And then the last thing I wanted to ask had to do with kind of the earlier stages of the pandemic. So we have the one piece of international law on infectious diseases is the international health regulations, which impose a responsibility on countries to report outbreaks that would be of international concern. China did that after a delay. But another part of that is that countries should take steps to limit transmission while causing the least disruption to trade. The language isn't quite as I described it, but it's roughly like that. And the reason for that is historically, one reason countries have been reluctant to report is the fear or expectation that other countries, once they hear about the report, will respond by restricting trade. And so it was thought that those two things need to be joined together. But when the World Health Organization was recommending against any restrictions, other countries complained about that. So I'm also curious, what I've read is that the trade restrictions that were imposed, travel restrictions, trade restrictions, that they had limited effect on reducing transmission. Maybe they would have bought a few days time, but not much more than that. So it didn't really seem to have a huge effect. And I'm just wondering in that category whether you think the health regulations should be revised. They were revised after the SARS outbreak. Do they need to be revised now, particularly in respect to the trade and travel restrictions? Well, I'm wondering if maybe Chad would want to go first. I don't, or
Yeah,
Merit.
I'll let you go first to answer the US question.
So I'm happy to answer the US question. Look, I think I don't know with the Biden administration. I'm hopeful, right? I mean, they've sent, they've signaled a lot of positive things about, re-engaging with the World Health Organization, kind of putting a priority on the pandemic. And so this would seem to be an easy way to show to the world that America's back, right? And that we're willing to contribute and we're multilateralist again. So I think there's an opportunity there, but whether they're willing to do it or not is another matter. We don't have a great track record, ourselves. I think it was H1N1, during the Obama administration in 2009, where we had, it didn't turn out to any great degree, but we did similar sort of hoarding on kind of the vaccines that were getting produced at that moment. So it's not as if we have a great track record even in better times of sharing, but I'm hopeful that they will treat this seriously. Now, that being said, you know, given how badly we've mismanaged the health side within the United States, there's nowhere in the world more demanding of the vaccine than the United States to bring the pandemic under control at the same time. So other countries might want to be sharing it with us just on purely health grounds.
I would just add, unfortunately, this is we have these institutions and they're underperforming generally. So at least the WTO has lost a lot of confidence. The world, I think, is not moving the rules forward. I was interested to see this Ottawa group get together and propose an agreement of, I think there were some 13 countries and pretty heterogeneous, calling on WTO members to increase cooperation to ensure against restrictions on exports, mostly of goods, to implement trade facilitation measures, and improve transparency broadly. And so that's the kind of step that I think would be supportive if it would be possible to also reach other agreements on the health side. But it's an institution that has had great difficulty moving forward this agenda. The US is still opposing. We'll see what the Biden administration does with respect to the new Secretary General of the WTO. And so I think expecting that institution to be able to impose hard rules in this area, I'd be concerned, but hopefully could nudge it forward in a way that would be supportive.
Can I intervene here before going to Murray? Because I have a point that I want to make, but I think then we'll transition to something I'm curious about her as well. And it ties to this sort of the Ottawa group approach and what the international system could be doing better on this. I think what's really not enough is for all of the focus on transparency. It's all about the transparency on trade policy. And the real problem that we're having with transparency is the lack of insight is to the supply, the capacity, the consumption, and the stockpiles of everything in the medical space, right? We have insufficient information about how much PPE is going to get produced anywhere in the world at any moment in time, how much is in stockpiles. Same thing about vaccines, right? We're really unclear as to where these pharmaceutical companies are going to be able to be producing this stuff. We have some sense of the India numbers, but the others, how much is getting made in the United States versus Europe. And so in looking at earlier parallels, when we've seen these sorts of export restrictions in hoarding during panic, when there was lack of information about supply, it was frequently in the food space, right? And so one of the developments after the commodity price crisis of 2008, 9, 10, 11 was this implementation of AMIS, right, through the G20, the Agricultural Monitoring Information System, I think is what the acronym relates to. And it was basically to provide transparency in the food and the agriculture space to head off concerns that were unreasonable about the prospects of famines, so that countries didn't start imposing export restrictions when they weren't really, really necessary. And I think arguably we need to have something now in the medical space, not just transparency about the trade policies, but actually the transparency on the underlying goods that we're all ultimately going to need to be able to deal with these sorts of pandemics. And we're a long way away from there yet, as far as I can tell, in the international policy space.
Okay, if I can, I just add very quickly, because I know Jeff would also like to ask a question. I would just like to agree that addressing export restrictions, if you think about the rules, actually it says you're not supposed to have restriction of exports or quantitative restriction unless under very certain conditions, right? But of course, nobody has been enforcing that. We went through this in the 2008 crisis. And in the G20, in around April, it was May actually, they did come up with these principles, right? That it should be measured, targeted, transparent, and time bound. And WTO was supposed to monitor this. And in fact, the restrictions did go down. And in fact, there have been some liberalizing on the import restrictions, tariffs, as well as on the trade facilitation side. So but we are now worried that with the vaccines, what will happen in the forthcoming period. And for now, food is okay, production is okay, but what happens if you start having food issues again, food shortages issue again? So I think I would agree with Chad that one of the answer is transparency, and not just about the trade, but on all those issues that he mentioned. We, for instance, we will be publishing all the whatever the World Bank financing procured vaccines. We will be making that public, and we want to urge, especially the advanced countries, to make it very public how much they are buying, and where is it manufactured, and even the pricing, right? The pricing, because there's going to be, Astra is using a flat price, but the others are using tiered pricing and so on. So to get to the fair and equitable access, we also need pricing information. So we're actually looking at this and looking at how we can have transparency. There are transparency CSOs organizations out there. There's a People's Vaccine Initiative. So they're collecting information as much as possible. And I think if there's a collective effort on this, I think we would be very supportive of that. And whether G20 could also take some action on that, just like they did with food. And we are working also with countries on the food side to make sure that there's this transparency. Just finally on your question, Scott, what I meant was that, World Bank has IDA countries, which are the poorest countries, below 1,800. And then we have the lower middle income countries. So the IDA countries typically get grants or very concessional loans. They already have an envelope for using that, and they can use that to get the vaccine. And some of it will we don't know quite yet. Some of it will also be funded by COVAX itself. Depends on whether they will be successful in being able to raise the funds. But for the lower middle income countries, then it's more the financing, and the financing is not just for procuring the vaccines, but also to help them develop the capacity to deliver the vaccines as well.
Thanks to both of you. Let me jump in with just a couple of questions of my own. First, coming back to the very beginning discussion, what evidence is there, are there cases of sheer physical disruption of international supply chains that are significant, or big changes of costs of trade, as opposed to the kind of restrictions that were put on by governments because of shortages? One obvious thing that comes to mind is obviously vessels are shipping empty, passenger flights are canceled, and they carry a lot of freight. So what's happening actually just to the physical knock-on effects of trade, other than shifts of demand or government intervention on restricting supply? Second, what's being done to restore travel and trade through agreed protocols? I spoke recently to IATA, the trade association for air transport. They're very frustrated in that they don't feel, that they're exactly at the table discussing with the health ministers what is the best way to reestablish trade. I couldn't judge, on the details, but the question of countries that have successfully suppressed the virus opening up to each other, what do you see that is working in terms of re-engaging? And then my third question on COVAX and the vaccines is a couple of just details. Where did the pricing come from of these vaccines, other than companies declaring the price? Did anybody negotiate any of this? If the World Bank is funding $12 billion, for what? Was there a negotiation? Where did it come from? Because companies are just stating prices, $20 a vaccine. This is not a market. and it's all funded by public money. So we will turn around and find that a few companies made tens of billions of dollars of windfalls, perhaps. I'm just curious who's watching those details, and is there any new financing other than reorienting IDA? Did any of our supremely generous rich countries actually provide new financing? Just curious.
I'll give you very quick answers to some of your questions. Of course, it has had a huge impact on trade. The negative contraction is clearly showing that, and it's disrupting everything: travel, shipping, aviation. I mean, the services part of trade has not recovered at all. It's still like -20, -30%. Anything that's face-to-face services has not recovered, but actually the digital-based services have gone up. It's positive growth, like finance, ICT-related business services. They've actually gone up, but I think it has huge disruptions. And I think the other aspect, of course, is commodity price decline and remittances decline, which hits developing countries very badly. And those who depend on tourism also hit very badly. So I think we are still going to see a lot of adjustments that will have to come. And I think my other worry is that investment. A lot of this cannot happen without the recovery of investment, and that also doesn't look very good. You asked a question on how to reestablish trade and travel, and actually, Scott, you also asked this question earlier. It seems like countries that have been successful in containing, they do very stringent lockdown. I heard China just locked down again because they're afraid of a second wave, or they saw a rise in cases. So now you can't go to China. It's just locked down. Vietnam did very severe lockdown early on, and that's why they were able to contain. So I think, so how do you then start opening up, and how would you do it safely? What are the health protocols? In G20, I think the China proposed a QR code. It's a little bit like your yellow immunization health certificate. But how do you do this where everybody agrees this is the standard test that everybody will have to have? And then if once vaccines are there, this is the vaccine that I had. How do you monitor that? But I think with digital technology, actually, it's very, very possible. And I think that's going to be the future of safe travel. But it really rests on testing. I think Singapore may be another good model. They're trying to open up bubbles, of safe travel with some of their neighbors, like Hong Kong, like Malaysia, like Indonesia, but only very restricted. And you get tested when you arrive at the airport. Again, they have testing facilities at the airport. So I actually think testing is going to be the main key. And can we develop tests that can give you very quick and accurate results? And that will also help, not just for travel, but also going back to work. I think that's the key. The last one on COVAX, yes, you're right. This is and negotiating of prices. COVAX does negotiate with these manufacturers. I mean, in this whole ACTA framework, there is an association of these vaccine producers. And some of them do tiered pricing, some of them do flat pricing, but they've all promised that they're not making profits. But of course, we will. This is why it's important. The transparency and the monitoring from outside is going to be very important. And we are, to the extent countries are doing bilateral negotiations with companies. If they ask us to help, we will also help. And the good thing about having because we are dealing with many countries and many companies, we probably will have intelligence, right, to be able to share between countries as well. We have a platform that we've developed across countries.
Interesting.
Let me just maybe take 2 seconds on the trade question, just because it's fascinating and it's not all bad news. And so as Merritt mentioned, I do this podcast on trade, and we had a couple of weeks ago somebody that's from the kind of shipping, freight forwarding, monitoring sector. And so, yes, I think as Marie pointed out, it's been devastating for services, for tourism, for education. That sector has just been wiped off the map because nobody's moving. But there are sectors that are doing relatively well. Autos is not doing as bad as you might have thought, not as bad as the 2009 crisis. Why? Because people don't want to travel by public transportation anymore, right? So they want cars. So the auto sector hasn't done as bad. Electronics, probably everybody's working from home. We've all had to now buy giant monitors and equipment to set up our Zoom sessions. And so you do have, interestingly, initially during the crisis, the response by the shippers was what they call blank sailings. So they stopped sending as many of the cargo ships. They just took them off the water. But by later in the summer, they had recovered enough that that basically had stopped. And now, just as you indicated, Jeff, there is this massive discrepancy there's always a discrepancy between the price of a container, one of these 40-foot things that comes from China to the United States. It's usually 4 times the price of going back in the other direction just because of the asymmetry of trade. But now it's, 10 times the asymmetry. There's so much stuff coming from China, from Asia to the United States, despite the pandemic. And so there's this shortage, and with this price so high, it's pulling containers off of subroutes, so the sort of hub and spoke. And so you read these stories of other places in Asia are having the containers taken out of their markets because they're so valuable on the main route from, say Shanghai to the port of Los Angeles or something like that. So it's not all a negative trade story, but it is certainly being disruptive, I think, for a lot of different elements out there in the global trading economy because of the pandemic.
But it's pretty impressive that the logistics side is not the barrier so much. The barrier is economic demand or people traveling, but not logistics per se, of either on shipping or aviation, saying it's not safe to send a ship. I mean, that part's working actually.
Yeah, with the exception of these stories that they're not letting the workers off the ships. And so, they're being forced to not be able to, to leave, to be able to fly home, to change crews and things like that. So
that's interesting. Yeah. So Marie, in COVAX, the companies are committed to a no profit standard if they're selling under COVAX?
You're on mute.
Well, they have agreements, at least for the 20% that they're allocated. So there's two windows in COVAX. One is the self-financing window, and then there's the window that is subsidized using the donor funds. And that's the one that's really not just at cost, but even zero cost to some countries, and then subsidized costs to some other countries. And then there's the full cost, meaning they say it's at the marginal cost, not at the
right.
For the COVAX. But then outside of that, then they can charge higher prices. So they have a tiered pricing system, and it also depends on your level of development as well.
I think it's, I don't want to begrudge these companies who could save our lives and save the world, but this is not a market exactly. Everything is so
exactly
completely intertwined with government support, financing, and all the rest. We shouldn't have profiteering in the end on this somehow. So it'll be interesting to see whether we've sorted that out.
Yeah.
Can I?
We still have to wait to see how this comes out.
Scott and Jeff, if I may, just a follow-up question to that, and then another question to Chad. How do you make sure that the vaccines that are supposed to be in the developing world don't come back in the developed world? That wouldn't be the first time. Basically, that the US would go and repurchase those vaccines at a higher cost, at a higher price, and the countries would make a profit off of that and not vaccinate. So question number one. And then a comment to you about the vaccination. You said that the last time that we did the mass vaccination was smallpox. That is true. Major difference though, the vaccines that are coming out of the pipeline now all require ultra refrigeration, Pfizer -70, Moderna -20. AstraZeneca is the only one that's regular fridge, but it's also less efficacy. And then I had a question for Chad, if I have one more second, which is, so has there ever been a situation in the world where we found ourselves with the entire world looking for the same supplies at the same moment, while at the same time the manufacturing was on at a standstill, which was the case for the PPE and the masks? And what kind of lessons should the world learn? Obviously, one of the overreactions would be to do nationalism or reshoring, but what would be the right way to deal with that? So maybe Maris.
What was the first part of your question? I got the part about it, the different about the mass vaccination, but what was the first part again?
So whether there were mechanisms in place to prevent that the vaccines that are supposed to go to the developing world come back to the developed world?
Yeah, that is certainly an issue, and actually with the TRIPS issue, the TRIPS provision actually allows you the compulsory licensing for the manufacturing country, but if you export to another country, you're supposed to have all these very restrictive requirements, even different color, different production line. That's very onerous, but there has to be a way to prevent, re-exports happening, and that's certainly something in everybody's minds also. Thinking about it. And second, you said about vaccination is it's different because of the cold storage. Yes, that's true. And you have to think about take polio as an example. The ones you take orally, they're much easier to much more, less costs, very easy to deploy, especially in developing countries, even though they have less effectiveness, right? So you have to kind of balance the realistic on the ground practical solution with say we couldn't do Pfizer, for instance, even though it has 95% efficacy. So, but you would still get a wider part of your population. So I think that's kind of the way we look at it. Yeah, I think those were your two questions, right?
Yes, thank you.
So on the question about the alignment of the shocks, and I agree. The problem early on in the pandemic in January was you had this perfect storm of everybody needing this PPE at the same time, so this massive demand shock, or sequentially. But the first place where the demand was needed was where if there was excess supply was going to be located, and that was China. And so I think, and when we look at the trade statistics after that, right, this clearly shows up. It's 50 to 60% of the world supply of trade, not world supply, but world supply of trade of exports come out of China for this equipment. And I think the lesson of that, strip aside any trade war things, strip aside any concerns you might have with China for other reasons, is that's probably not a good solution. Just because you could have this happen. So you need to have some additional global diversification on the supply side for this equipment, especially I think because then you tie in the sort of the health and the pandemic and where that's more likely to originate, and we know just scientifically that it's more likely that some of these things come out of China. So it's not as if this was an unexpected event. How you get there, I think that's a trickier problem, because I think there's efficiency and cost arguments to suggest that the fact that it ended up there was not bad economics. It was efficiency, but we may need to think twice about the purely efficient outcome given the nature of how future shocks might come in. But that's going to require some policy interventions, I think, to get us out of that equilibrium that aren't trivial to deal with.
Well, I think this discussion actually raises another question about the vaccines that were developed, and you really, the value of the vaccine is whether it can be used. And a big part of that value is whether it can be used globally. And I don't know how much attention was given to that, either by the companies themselves or by, in other words, the failure that you can see at the global level in distributing what's available could have percolated up, if that's the right way of putting it, so that the innovation was done in such a way that the firms would have more control over distribution subsequently. So I don't know if that was much of a consideration. There has been innovation in the past to make technologies easier. Well, the smallpox program that Mari mentioned, I mean, they definitely were innovating so that they could overcome the cold chain issue as the program advanced. But I think this is going to be a big issue. Having a vaccine that can't be distributed or even produced in developing countries, that's a failure. It may be a different kind of failure from the kind we normally look at, but interesting. There was just one question I wanted to just raise really quickly from one of our great students. This is from Chengguan in China. He asks, how can the WTO help to balance countries' expressed needs to screen incoming goods? He said that he's heard in China there's a concern about imports of frozen meat carrying COVID, and the fact that these screenings are being used as a form of protectionism. Any thoughts about that?
Well, I think, the problem is that the rules are there to be triggered if there's a problem. They're not really there prophylactically. So I think, I think if there's a disguised restriction on trade, then it can be challenged. We've had almost no cases like that. But and those that have arisen, have taken a long time to be adjudicated. So, I think there are rules, and they could be triggered, but they're not going to operate in the kind of real-time intervention that is suggested by the question. Would be my regrettable assessment.
The rules are actually very clear. It has to be transparent, it has to be scientifically based, and if not, you would be challenged in the WTO. And as someone who went through this many times in my own country, I think when you do impose restrictions, you have to keep that in mind as a country. But of course, as Merit said, maybe you impose it until such time that the dispute tells you that you have to take it off, right? So there is that practical issue. But again, the message is the WTO dispute settlement has to be part of this reform of the WTO, hopefully in the forthcoming period, as still urgent and priority. Because you can see if you can't take it to a dispute, or it would be difficult for you to do it, then you can't solve. You will not have, the rules won't work.
One of the things I learned, is that even if one country sees, rules or practices are struck down and another country is doing exactly the same thing, they don't respond until they're challenged. They don't say, oh, that's impermissible and self-correct. No, they wait to get hauled into the tribunal. So it's a challenge.
Yeah.
Well, terrific. This has been great. Really enjoyed the conversation. A lot of really important points were made. A lot of information was shared. I want to thank Dean Merit Janow for organizing this, Mary Pangestu for joining us from the World Bank or from her basement, wherever you are, Mary. Chad Brown, thank you so much. You've obviously been covering a lot on this topic, and it's really important for the trade system and for addressing COVID. Jeff, terrific as always. Giannis, thank you so much. Great questions. Andrew, we couldn't do any of this without you. Thank you. Thanks, everybody, and thanks all the students for joining. Take care, everybody.
Stay safe.
Good to see you.
Thank you.